Hello everyone, it's Michael Jones. I'm back here again for tip number 32 in our MET101 ebook series. Now, this one looks at the idea of skills. So what skills do I need before opening my MET practice? So question number 32, what skills do I need to start an MET practice? We've identified what we consider to be the 52 essential skills that a medical exercise professional must become proficient in. Not at once or immediately, but once you take your certification as a medical exercise specialist or a post-rehab conditioning specialist, we have a checklist of 52 essential skills. Over the course of the next 2 to 3 years, you should become proficient at all those. And we looked at it this way. As a physical therapist coming out of physical therapy school, yes, I knew all the skills. I knew the skills enough to pass my state board examination and to graduate. But was I 100% proficient in the skills? And did I have competence in applying them? Folks, one thing you have to remember is getting a certification is one thing, but becoming competent and becoming proficient and being able to apply those skills is a different thing. And in the fitness industry, the tendency is you're taught a skill, you go off and do it on your own. In the healthcare community, you're taught a skill and there's a licensed professional looking over your shoulder to make sure you're doing that skill correctly. So I think one of the things we have to really do in the medical exercise community is to make sure the skills you're using are done professionally, they're done accurately, and we're not making up our own skills along the way. Please, let me finish with this. So we've identified 52 essential MET skills all medical exercise professionals must be proficient in at a high level of competence. Go to our medical exercise skills checklist. We'll have a link here down below where you can actually download it to download the checklist. Within 2 to 3 years of starting your medical exercise specialist training program, as in the educational program we offer, you should master each of these skills. So you don't have to know them as soon as you finish and get certified. These are skills you're going to gradually learn over time. There are a few very, very essential skills you should know right away. But there are other skills that you'll gradually learn along the way, just like a medical professional would. I think it's important to understand MET skills are acquired over a career. For medical professionals, there's always a new skill to learn, a new technique to apply to a condition, or a new piece of equipment to operate. The same is true in medical exercise training. You're not going to learn these skills at one time. You're going to learn them over time. Some of these skills are demonstrated in our medical exercise specialist training series workshops or our advanced medical exercise specialist training series. All these MES skills are outlined in the skills checklist and are taught in our medical exercise specialist training series or our AMES training series. Please, if you would, when you download a digital copy, you should have a link there. You'll be able to download it, or down below this video, you should be able to click the link and download that skills checklist. Now, the skills checklist allows you to grade your proficiency with these skills. Now, let me offer one thought here. There are 4 levels of skill proficiency that we've noted, or skill competence. Skill level number 4 is where you can actually teach it to someone else. So before you check all 4s, let me make sure you understand. Teaching this skill, which many of these skills are primarily seen in the healthcare side, they're not often seen in the fitness side. If you taught this skill to a student and they went out and performed the skill on one of their clients, would that skill hold up to the scrutiny of another medical exercise professional, or maybe a physical therapist or occupational therapist coming along and looking over that individual's shoulder to say, are you doing it right? Remember, the skills or the knowledge we give a student is only as good as the professor or the teacher offering that skill and their ability to convey the information, to teach the skills. So please understand, we have 4 levels. Level 1, 2, 3, 4. 4 says you can teach it. 3 basically says you're proficient enough at it that you feel comfortable with it. So please make sure as you grade yourself based on not what you think, but what would happen if someone that was an advanced medical exercise professional, maybe even a healthcare professional, stood and watched you perform these skills. Because we get all 4s all the time, and I can tell you, it takes a long time to get to the point with all 52 skills, you are 100% proficient. So please go down below, click the link, download the checklist, but also please go over to MET101ebook.com and download your free copy of our ebook. I think you'll find it's very interesting and very helpful to you. So thanks for watching. All the best. We look forward to seeing you in our next tip.